Hello and welcome back to our tutorial on Part A Medicare benefits, also known as hospital insurance. I am Brian and happy to have you here. Please visit our forum where you can post comments, questions, answers, and get answers about Medicare. In this tutorial, we're going to talk about enrollment and eligibility. You will hear some information that you already heard in the other tutorials, but that is good. I learned in the Navy that repetition leads to perfection, and that is also good. Our next tutorial will be on Part A, coverage and costs. Your enrollment into Part A and Part B can be automatic if you're collecting Social Security or railroad retirement benefits, if that applies to you. 95% of the time, you will receive your red, white, and blue Medicare card in the mail from the Medicare office 3 months prior to your birthday. And that's when you know you were automatically enrolled into the original Medicare. As you remember, this period is called the Initial Enrollment Period, or IEB. And you also remember that your Part A coverage begins on the first of your birth month, unless your birthday is on the first of your month, in which case the coverage begins the prior month. This eligibility is purely based on your attained age of 65. So it's basically based on the age. Now there are other eligibility criteria that are based on other than age. And we're going to talk a little bit about that. Is there a premium? Those that are automatically enrolled do not have to pay a premium for Part A because it means that you already work 10 years, you accumulated 40 credits, and you paid it into Medicare taxes. So you are eligible for the benefits that Medicare has. However, there is a sizable population of senior citizens that for one reason or the other did not work the full 10 years to collect Social Security, which also means that they did not pay the Medicare payroll taxes for the 10 years or the 40 credits. And this group has to pay for Part A, and not only that, they must personally go to the Social Security office and enroll into original Medicare Part A and Part B. So basically, you are buying the benefits for a monthly premium. Now the maximum that you will pay is $411, and that is 2016. And the minimum you're going to pay is $226. Again, those are 216 numbers. There's also another group that decided to continue working, so they are not receiving Social Security. In that case, they have to again personally go to Social Security and enroll into Part A and B, and they do not have to pay the Part A premium because they already had their full 40 credits to receive Medicare benefits Part A for free. Now, it is important here for those that have to buy Part A that you must make sure that you have to enrolled during the IEP. If you wait after the IEP, you may pay a higher premium. Now the good news is that you will not pay a higher premium for Part A if you enroll anytime within 12 months of the IEP expiration. So if you enroll after 12 months of your IEP expiration month, you will pay a higher premium, which is going to be 10% of the first full 12 months of the expiration of the IEP, and you're going to have to pay that for the next 2 years. If you wait 2 years, a full 24 months, the penalty is 20% of the premium, and you have to pay that for the next 4 years. It sounds confusing, doesn't it? Well, here are some examples, and you can read this on your own time, and it will kind of clarify some of these questions and clear some of these confusion about that. So please take your time and read this. These are some exceptions to premium penalty. And the good thing here is that if you have a spouse that is qualified to receive Medicare because that person has already worked there for the 10 years and they have the 40 credits. If the spouse has not ever worked and she's 65, she will be able to receive her Medicare benefits, and based on the spouse work history, she will not have to pay Part A premium. That is a great thing, isn't it? These are some of the circumstances where a person will receive Medicare benefits not based on age. If you're disabled, if you have Lou Gehrig's disease, if you're claiming child disability benefits, if you have ESRD. So each one of these situations here, it has complex rules. So what I did here on this slide, I gave you some links, situations or events that you may have to deal with based on these. You can click those links here, so I do ask you to go back to my website where the clickable links are there and go into there. They are from credible resources like Medicare.gov and Medical Rights. So please take the time to do that if it applies to you. And even if it doesn't apply to you, it's good to know because you may have a friend or someone that falls into these situations, and at least you know where to send them to get that information so they don't have to pay a lot of money in penalties or such. Once again, I want to thank you for your time. Please feel free to call me anytime for questions on how I can evaluate your plan, your Medicare health plan, to ensure it meets your needs and your budget. Our next tutorial is going to be on Part A, coverage and costs. So until next time, have a great day. Thank you.